So we're off to week 2 already. We started with week 1 quiz. We did really well. Next week, there is class. There is another quiz. It'll be on this week's information. So what would you do for next week's quiz to look it over? Go over the Kahoots, go over the PowerPoints, and if you need more reference to the information and understanding, go either to the recording or go to the book PowerPoint. All of those things are there for you. Um, the discussion questions, I just briefly looked at them. If you handed it in and you had peer responses and you had a reference in there, you got a 20. If there was no references listed, you got a less than grade. I didn't look at when they came in, what times, because I know there was movements in classes, etc. So I didn't hold you accountable. So next week's or this week discussion question that you're doing, discussion week 2, not only am I going to look at references, I'm going to make sure that you cite them within the body of your paragraph. And that's making APA that final step. I know most of you, yes, going back in your RN, but I know some of you already have dreams for that nurse practitioner or, something beyond an associate degree. When you get to that bachelor level degree, it's all papers. It's papers, brochure, PowerPoints, picture boards, APA format. So I'm trying to help you get there. Now, if you're having a trouble with APA format, you need a quick tutor just to show you what I'm looking for, just meet with me quickly and I'll let you know, because that is what the paper on week 8 that I'm looking for. Now, mentioning week 8 in the nursing pediatric assessment project, start thinking about a diagnosis that could be a child's of something that you want to know more about. I've had so far people tell me about their son, telling me about their best friend, their next door neighbor, themselves, and their daughter, different diagnoses. And why I'm telling you to do it, it makes it less of a chore. It's something that you're interested in. And you really need to know, or because you want to know more about somebody close to you with diagnosis. It's a great time to pick that and maybe even starting to do that. Only it's a 250-word paper, just a description. And in that paper should be 2 references. If you hand them in early and that spot on week 8 in the modules, it's open that you can submit as many times as possible. If you submit a paper early, I will look at it, see if it's an APA format, and tell you if you're going to get full credit for it, or show you how to put it better in APA format so that this project you get the best possible grade you can. It is 6% of your homework grades. It is quite a big portion. It's more than the NCLEX questions all combined, and it's equal to all the CJ Sims combined. So it's a big hunk. So if you want help with it, submit it early. I'll resubmit it back. Let me know it's there so that I can help you just in case I don't overlook it. All right. Now, by Friday, Saturday, I'm going to be sending out a exam 1 review. It's going to tell you that all the professors that are doing RN classes are going to be doing an exam 1 review. They're going to be doing it all different times of the day, all of the different weeks. I have people who do it on Saturdays, Sundays, and then during the week in the day and in the afternoons, evenings. So there is a time if you want to do a live review. Now, you do get all the recordings. I put it in one announcement and it will say exam 1 review recordings. And I will keep editing and updating that one announcement to show you that's one place where all the recordings are. Now, I was trying to figure out what's a good time for me to do it. And I was thinking more of, according to the other class, Thursdays was a better day, and about 4 in the afternoon was a good day. So I think on week 3, on Thursday at 4 o'clock, I'll be doing a live review on exam 1. Now, I'm going to send you out the guideline. I'm going to send you out everybody's Zooms when they want to do it. I'm going to send you all the Kahoots. I'm going to send you a math page for exam one. If you can do those problems, you're going to do fine on exam one calculations because they're the types of questions with different numbers and names of drugs in them. So if you can do those questions, you're good for exam one. All right. And then what else? That should be out with the study guide by Friday or Saturday at the latest. I'm working on putting that together right now. Any questions?
Yes, are those reviews going to be recorded? Because I have a class on Thursdays at 4. So,
That's what I said. All reviews are recorded. They will all be on the announcements in one place. And all of you know that the first place you'll see my recording is on my YouTube channel. And you don't need for me to give you a link. Go to YouTube, go to Professor Bogart, Pediatric Nursing, and you'll see the last 4 years of recordings that are there from me. And you'll see as soon as it's uploaded, because I need that link to put it for everybody else. So that's the first place it comes up for everybody.
Where was the link to the Cahoots for the quiz?
The Cahoots, I always put it in the recordings. I don't put Cahoots when I send it out to you. All right. I want you to look at the chapters or look at the PowerPoints, come to class, listen to the information, and take the Cahoots. After class and the Cahoots is done, they are always in the announcements. Another place they are listed. If you go to the YouTube channel in information, you'll see the Cahoots there, but you have to cut and paste it and put it in the URL. It's not a direct link. You have to cut and paste it for it to work, but it does work from there too. And if you can't find it, you're having a problem, let me know and I'll resend it to you. Now, for the exam, I'm going to send out an announcement which has week 1, 2, 3 Cahoots there. It's going to be right there for you, ready to use. And you already have the PowerPoints. I'm going to give you the study guide PowerPoint. And then I'll be giving you the math guide for exam one. All right. Did I answer all questions? Right. So here we go with chapters 31, 32, and 33. I think probably these are my favorite kids. These are the young children, thirsty and anxious for knowledge, right? These are the ones that you've got to watch. They need more looking after because, something could happen to them because they don't know better. Now, we know infancy, like I said last week, it's amazing how quick infancy goes in 1 year, how they grow, and how much weight they gain. Know that it's never replicated this fast and this much growth at any other time during your whole your life. It just never is. We know that the big thing about this development is that we need to feed nutrition, nutrition, nutrition. We need to put gas in that tank, give that brain all of the fuel it needs so that it can grow and mature and be healthy. And you could see this one sentence here that says, effects of poor environment, including poor nutrition, cannot be reversed if it's there for a long time and it's not captured. Now, how do you think that we would capture poor nutrition? And we would say to the parents, what are you feeding the child? What's going on? Well, what do we do every doctor's visit, every urgent care, every ER? We do a height and a weight, right? And the weight is going to tell you, are they gaining weight? And if they're gaining weight, all right, we know at least that is okay. But number two, we're looking all of that fine and growth motor skills. Are they able to lift their head by 3 months? Can they roll over by 6 months? These are things that we'll be looking at because that's going to really tell us, okay? So that's how we evaluate nutrition in infants. At birth, they lose about 10% of their body weight, full of all that extra fluid, from floating around in mommy's amniotic fluid, right? After that, they lose it all up to 10%, and then they start gaining a weight. By 6 months, they double their weight, and by 1 year, they triple. Okay, that was a quiz question. And it's an important concept because what if your baby is 6 months old and born at 7 pounds and they weigh 10 pounds now? Wouldn't that alert you that child needs something? You'd be looking. That means maybe more nutrition's needed. That would make you look at developmental skills. Are they alert cognitively? Are they where they should be? Because they're not getting that nutrition. Or are at birth 7 pounds and at 6 months they're at 18 pounds, which means they're too much, which means the movement is going to be less as quick because the baby's heavier. It's more weight to move around and be mobile with. So you've got opposite ends. This is why we need to know born at 7 pounds doubles that at 6 months, which would be 14 pounds around there. And at 1 year, 21 pounds, right around there. Okay. Another thing that happens is they start getting taller. Now, 1 inch per month for 6 months, 6 inches in the first year, this baby grows. I mean, it's amazing how quickly they're growing, right? So they've tripled their birth weight and they're now 8, 9 inches taller than what they were. It's quite amazing. Also, if you ever look at an infant, you'll watch them get pudgier and all of a sudden they get taller and they get leaner, slimmer looking. And then they get pudgier and then they get taller. And this is just what infants do. It's like they pack in the calories and get the fat on and then whoop, they squirt up. And this goes all through childhood, actually. Now, infants are born. Last week, I told you neonates, birth, heart rate 140 to 160, and your respiratory rate 40 to 60 at birth. That's normal. Why do we need to know that as we get older, the number, it matures, so it slows, which means the effectiveness of breathing or heart beating is more effective. So they can slow down the heart rate and the respiratory rate. It doesn't have to be as fast to keep up with that child, okay? Now, if my heart rate is 100 and I need to give digoxin to a neonate, oh, gee, now I understand why I need to know heart rates, right? This would be a concept you need to know. What if you're giving blood pressure medicines? And it does happen, giving them to neonates. What is the normal blood pressure? And the answer is 60/40. What if your blood pressure was 30/18? Now, what do you do? Again, this is telling you intervention required, not needed. Again, knowing those basic numbers can help you with thinking, that critical thinking that goes on. Now, at birth, mommy gives the baby everything. Gives her the blood, her hemoglobin, her hematocrit, all of her immune system antigens, all of that goes into from mommy into the baby. Well, blood cells and immune stuff just fades away and goes away, right? Baby has to produce their own. Baby's lucky at first to have mom's immune system to protect them, but think about how we give immunizations to an infant. Well, the number one is hepatitis B, usually at the hospital. If not immediately that first visit, they'll be giving it to that infant. But we're giving multiple immunizations at 2 months, 4 months, 6 months, 1 year, 15 months, 2 years. We are loading up these children with all these immunizations on diseases that can be preventable with them. And these are diseases that are really rough to cure. So it's better to prevent them than to fight the disease itself. So it's something that, we need to be looking at and making sure. Now, as mommy gives the hemoglobin hematocrit to the child, a normal hemoglobin hematocrit would be like mom's at birth. 1452 sounds like great numbers, right? Well, blood does die, doesn't it? It doesn't stay alive forever. Also, babies don't start making their own blood till after 3 months, closer to 5 or 6 months. So hemoglobin hematocrits do drop, and they do go into what we call a physiologic anemia, but they tolerate it because slowly those cells have died, okay? So what does red blood cells hold? It holds that iron, and that's an important part of nutrition. Why do you think that at 6 months, we start feeding infants, and now they're going to get iron through foods, iron through fortified cereals with iron. If they're going to formula, it is fortified with iron. So we're getting that iron back into that child through either those green leafy vegetables or whether through the cereals, etc. Okay. So mom stuff goes away, baby's not making it yet. We start feeding them, it helps with that iron, and then the baby start mixing its own cells. And then of course the hemoglobin hematocrit picks up by about a year old as that happens. Now, when babies are born, they're born with two soft spots, right? They have the one on top, the anterior fontanelle, and they have one in the back of their head, and that's posterior fontanelle. Now, the one in the back is only open for 6 to 8 weeks, and then it's closed. It's only open there so that there's extra space for the brain to grow initially. Because look, remember, these infants are growing really quick, really fast. Now, usually they're closed and we barely even knew that they were open. But if it's still open at 4 months, that's a problem. And that's why we know this number. The other one that's probably more popular in the way that we discuss it is anterior fontanelles. Know that the anterior is the soft spot on top of the head, that fontanelle. And it usually closes like before a year and a half. Say it says 12 to 18 months. So let's say a year and a half. Now, if it closes at 8 months, the brain's not going to be able to grow. That's a problem. Or if it's not, if it's open up and it's 2 years old, why is it still open? Is it hydrocephalus? Is it a brain tumor? Something's not right that didn't close and it will need to be looked at. You'll see many questions related to that. There was one on this quiz today that had nothing to do with the anterior fontanelle. Anterior fontanelles are open till about minimum 14 months is when they're closed. Now, again, their immune system, we know how it happens. Mom gives it to them. They start building up their own stuff. We know that the body does when they start given all these immunizations at birth, that hepatitis B, that 2 months, 4 months, 6 months, the baby is making those antigen antibodies and is getting that protection from those bad diseases. Breast milk is another thing that is highly recommended because it is a constant flow of maternal antibodies. If mom's trying to get sick, get a runny nose, or the household is fighting it, mom's fighting it, well, mom is fighting it and then breastfeeding, and they're giving you that milk, and it has antibodies and antigens in it and can protect that infant from getting that upper respiratory or whatever it is. Now at birth, when babies are born, they're coming out of a wet environment and they're all full of fluid and they get cold really quick. They have no thermal regulation. If you've ever been in a delivery, they take the baby out. The first thing they do is put it in a baby blanket, put it underneath a hot warmer and rub it off, throw the blanket, get another blanket, rub it off, put a hat on the head and get that kid covered, don't they? It's because they do not have any sort of control of their temperature. As they get older, yes, they do control it and it's fine. And especially after the first 6 months, they're getting rid of all of that extra fatty tissue. And after birth, getting rid of all of that water fluid that they've absorbed because they can't keep that warm and that causes, the temperatures to drop. So just know that babies can't tolerate and at birth, we need to do something to keep them warm. Now, we're talking growth development, we're talking infant. We talk about growth and development two ways. There is fine motor, which is F fingers, anything with the hands, whether it is grasping or pincing or taking objects, putting them in out or building a block, stuff you do with your hands. The other thing we look at is gross motor. And gross motor is G, get up and go, go, go. That's movement. That's walking, that's rolling, crawling, all of those things. So start out with fine motor. Another word for grasping is called prehension. The first thing that happens is mommy takes her hand and puts it next to the newborn infant, and it's a reflex. They grab the mommy's finger, and mommy goes, "Oh, isn't that nice? My baby just gave me a hug." Well, please don't tell them that it was a reflex. That's what babies have at birth. Just let them think that the baby knows you. Say, "Yes, mommy, your baby does know you. Look at that. They are hugging you." It was a reflex. It wasn't voluntary. As it goes onwards, and it's called palmar because they do it in the palm of the hand. All right. Now, as they get older, they start using more fingers, not palms. For instance, put them in a high chair and put those puffs or Cheerios on the high chair in front of them. And then they take their fingers and smush with their fingers those little things in their mouth. That's called a crude pincer grasp. And then it gets to the point where, ooh, let me take one at a time. And they get a fine pincer grasp. And that's somewhere about 10 months. Now, at 11 months, they can take blocks from a container. And then by 1 year, they should be able to make a block and flower into a tower of maybe two. And that's what fine motor skills are. And there's a test for you. Now, gross motor. What's the first movement that an infant can do? It's with their head. They can lift their head up. Now, if you look at the picture on the top right, you see how she's holding the arms and that head falls back? That's a neonate. That's a newborn, a 2-month-old infant. When you hold their arms and you pull them up, their head lags backwards. There's no head control yet. As the baby gets to be 3 months old, you take their arms and it's like B and C. They come up with the arms. The neck can bring up the head with that movement. That is head control. That's lag. That's what head lag means. Now, by 5, 6 months, they're rolling over. Why do I need to know why they're rolling over? Well, it's a safety issue. What if they were on the bed and they're not supported? Nobody's there. Whoop, off the bed and onto the floor. What if they're on the changing table and you went to go run to get a washcloth? Whoop, they're on the table. And it's knowing those ages and informing our moms, guardians, grandmas, whoever, be careful at this age. They will roll. I've seen them roll off of changing tables, dining room tables, couches, beds, and kitchen counters. Babies coming in that had falling off that the parents didn't realize. Well, after coming into the ER, yes, they did find out and were more careful with safety with these children. The one thing we learned last week, sitting unsupported at 8 months old. That's a keynote. They're sitting there. There's no more pillows and blankets and stuff propping them up. They're sitting there now. Now, does it mean all kids are sitting at 8 months old unsupported? No. Does it mean they're almost sitting there unsupported? Yes. Or does it mean maybe they're, cruising by 8 months, which should be actually 9 months on the side of the couch, walking on the side of the couch, cruising? It doesn't matter as long as you're right in that age area. Some are small, a little bit farther ahead. Some are slower. Some are more with fine motor skills. Some are more with gross motor skills. My point is, all children are different. And as long as they're doing almost that or more than that, you're doing really good. And then the big one is being on their back, being able to roll over, get up on their knees, and then sit by themselves. And that's at 10 months. Locomotion, if one of the quizzes, cephalocaudal. We know growth, gross motor starts with lifting the head and by 1 year attempting or walking. Feet, caudal is feet. Crawling, 6 to 7 months. It's after they roll over. Creeping up, walking on the side of the couch, holding them, hold them up to creep around that couch. Walking with assistance or walking alone, that's somewhere about 1 year old. And that's all about G, gross motor, get up and go, go, go. That's movement. Now, nutrition. The first 6 months, all we feed is breast milk or iron fortified formula. And the reason is their bodies are immature, their GI tract is very immature and it can't tolerate food. In fact, if you give a child food at this early age, you're just going to see it come out in the stool. It won't be digested. And it's just a waste of time, calorie, and energies that this child has expended to eat that's wasted and worth nothing. And we don't do that. We give children, especially infants, what they need, and we don't try to overwork them. The best thing they say is breastfeeding for the first 6 months. Combine it with those foods, which is baby foods. There is grains, there is vegetables, there's fruit. Know that one food should be started at a time, only one, and you should wait 4 to 7 days before introducing another because we're looking for allergies. And kids early do have those allergies, okay? Now, as we start feeding these children in the 6 months, now the mother's lost control of, breastfeeding or bottle feeding, reading ounces. They really don't know how much they're eating, and now they're getting concerned. Even brand new mothers going home, especially if their infant was in a newborn ICU and they had to measure the liquid coming out of the bottles. They get home and they're like, I don't know if my baby's having enough. I don't see how many ounces. I'm not pumping it. They're nursing. And all we need to tell these parents is number one, are they gaining weight, right? That's always the key. Developmentally, are they where they need to be? And then very clearly, are they having 6 to 8 wet diapers a day? And that's telling you, guess what? You're doing good. Now, the first 6 months, breastfed babies do get vitamin D, part of their nutrition. As I said, at birth, the GI system is immature and it gets pretty okay to tolerate food around 5 to 6 months, they say. As I said, these are your second month foods. We start out with rice cereal. It's the least allergenic. And then we add in one at a time. And what do you think an allergy might be? Well, it could be anaphylaxis. I mean, that's easy one, right? But it could be as simple as vomiting, spit up, gas, colic, diarrhea, rash. It could be all of them. Or it could be to the point of anaphylaxis, all right? So again, it's knowing your infant, a lot of asthmas and dermatitis and whatnot are caused by foods. So again, it's knowing your child as we introduce them, watching them very, very closely. And as we're seeing sensitivities, making sure that we're prepared for that, anything that happens. My grandson at a very early age, we found out he was a tree nut allergy, which means like walnuts and pistachios. And apparently he had some chicken with walnuts in it or something. And my daughter called me, and his whole face was all swollen and lips. And she actually got him at less than 2, about 18 months. chew a Benadryl pill after she called me up and I validated the dose of it. But now she has an EpiPen. It's that serious. And it was the first exposure ever. So know that children, and they need to be aware that that can happen. We don't think it happens, but that one person that knows, if this happens, this is what you do, and then get to the doctor, to the ER, right? Now, sleep, activity. Well, at birth, infants don't sleep the way we should. We know that. My daughter's 24 weeks right now. She's turned 25 weeks. So pretty soon I'm going to go into the non-sleep mode because, you know, Nana's going to have to be there for the first month after the baby's born because she needs me to help her. But anyway, we're going to watch the baby sleep pattern and how they sleep and know that children usually have those little burst cycles at first, and then they eventually get into the cycles where they do sleep longer periods of time. It's said that breastfed babies do tend to wake up more than bottle fed. And the reason is breast milk tends to be thinner. In fact, they consider it a clear liquid, believe it or not. So they do. Breastfed is usually every 2 to 3 hours, and usually formula is 3 to 4 hours. And as much as we like those swings and walkers and playpens and all that good stuff, for infants, they really aren't necessary. But I love them all. Dental health, well, first teeth should come up 6 months is usually the earliest. They say no toothpaste and only starting add fluoride about 6 months, and it should be only a toothbrush, soft, or just a wet washcloth, a warm washcloth, wet, and just to keep the teeth clean before they nap, before they go to bed, trying to keep the sugar off the teeth and prevent what they call bottle mouth, which could be pretty bad. The things we shouldn't do is prop the bottle, no milk or juice in bed. Even water, they say, no bottles in the bed. And that's where the pacifier comes in. And then we know children have that finger, whether a thumb, a forefinger, they all of our whole hand. Kids tend to figure out orally what will soothe them. So if your kid's 8 months old, the rule of thumb, how many teeth? It'd be -6. It should be 2 teeth if they have any. And again, it doesn't mean all children have teeth at 6 months. Those are all the immunizations. Know that many of them are given at 2, 4, 6 months. Some of them aren't started till at 6 months, and that is your influenza. Know that varicella is not till 2 years old, and the MMR at 12 months. And these are given again to help try to prevent all of these bad diseases. Colic is just a very gassy baby, and we don't really all know why, no matter what medicine, no matter who feeds them gas, usually for the couple months, and then they grow out of it, thank goodness. We have babies who sleep a lot, don't sleep at all, only sleep in small bits. These are all normal. This is all normal for an infant. Another thing that can occur is something because of nutrition is what we call failure to thrive. How would we know a child was a failure to thrive? This is the child who is 10 pounds at 6 months and born at 7. They should be 14 pounds. They're not. That is a failure to thrive, especially when you go down and you determine the amount of breast milk, diapers, or formula that they're eating is an appropriate amount. And then we're like, well, something's going on. At that point, a full service type of review is going to be done. All right, positional plagiocephaly. You know, today, how do infants, how do we teach them to go to sleep today? We tell them to put the infants on their back, right? And the reason is because they've determined that sudden infant death syndrome, first year of life, baby dies in the sleep for no reason. It decreases, and it's shown through years I mean, many years of research showing that placing them on their back decreases the amount of SIDS death. So many infants today have flat heads in the back because that's the way they tell you to put the baby in the back on their backs to go to sleep. So many children, infants have it, and parents are like, but my baby's head is flat. What can I do? Well, sometimes it's going to require a helmet head, which will help with the molding. But what all we need to do is tell our parents is to use that tummy time. And that tummy time takes the pressure off the head. And actually, just that couple times a day can keep that head round and stop that flatness. One of the biggest causes for keeping a child awake at night is diaper rash, diaper dermatitis. You have a child with a bad diaper rash, you lather them, bathe them, and put all sorts of creams and lotions and ointments and nice diaper, put them to bed. They get to sleep, they urinate or stool, and they're up screaming because it's in a lot of pain. So diaper rashes seems like not a big deal, but it can create havoc in the sleep cycle and nap cycle. And when a baby doesn't get enough rest, the whole house does feel it. So know that diaper rash, how do we take care of it? Well, is it an allergic reaction? Did you just change food on that baby or formula? Can you know that you just changed maybe an ointment, a lotion, a shampoo, laundry detergent? All of those things can cause it. Also, could be the type of diaper. My kids did not like Huggies. They didn't like it. And my grandson was the same, did not like it. And they would look like that red within a day, if that was what it was. And that's when I learned, oh, that must be the Huggies. So diaper rash, leave them open during the day, and let the air get to it. And then there's all sorts of creams and lotions to use them. And then cradle cap. Babies are born with that white flaky on their scalp, and the mothers, especially on little girls, want to put cute little bows in their hair. And they've got this white flaky scalp, right? So they want to get rid of it. So the goal is just to wash it, soap and water, put some mineral oil or whatever lubricant on it. And then you just comb it very softly with a fine tooth comb. And eventually, all of that white debris will go away. So that's how you treat cradle cap. I was talking about SIDS, and we know that's because we used to put our infants on their bellies or on their sides to go to sleep, and they found out that on their back there was less incidence of SIDS death or near SIDS death. Now, ethnicity has something to do with it. Males more than females are SIDS death. They say a formula-fed baby is higher risk than a breastfed baby. So again, another reason to breastfeed your child if you can. Putting the babies asleep on their tummy. Cigarette smoke is always cigarette smoke there or ear infections. I mean, cigarette smoke causes many things. Having them too hot, over blankets. What if they just had a cold and there's a little bit of mucus in their nose? What's the first thing that an infant was taught to do? Well, they came out, they had to learn to breathe, right? And then they had to learn how to suck, swallow, and breathe, because that's all they do. They eat and they sleep and they coo and they cry. So just suck, swallow, breathe, put mucus in the nose, and that can also obstruct airway and can cause SIDS death. We know it is having that baby in the bed with you. I've seen that happen there, and not getting immunizations, and then having them in soft mattresses. They should just be hard mattresses and nothing in there. Safety promotion, injury protection. Whenever you're talking safety, injury, you're always going to hear motor vehicle. unintentional injuries, and most of them are related to motor vehicle injuries. Okay, that's the big thing with injury prevention in your young children. Now, Letitia's breastfed infant being seen in a clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention for that? Well, look at this very clearly. Breastfed infant, he's 6 months old. This child found her thumb. Is that bad? So we can say, see, we can reassure the mother that sucking her thumb is absolutely normal and it's just another thing to suck instead of her pacifier, right? Okay, this exam has quite a few questions on theorists. And theorists are these researchers who researching different things that affect a child as they grow and how they respond to them. Whether it's Freud, everything's sex, Piaget, cognitive or thinking, figuring things out. Erickson is all about the people around them and how they deal with those people. And Kohlberg is all about morality, right, wrong, a consequence for each. Those are the four theorists, and now I'm going to try to explain them to you. So Erickson is all about psychosocial. That means trying to respond to the people and the environment around them. If an infant trusts, he cries, somebody comes, changes my diaper, feeds me, and goo goos and gagas and makes me happy. I'm a trusting, happy, healthy, sweet child because all my needs are met. Now, what happens if this infant is in an environment where maybe there's drug abuse, alcohol abuse, homelessness, poverty, not the bestest of environment, and a baby cannot, for whatever reason, or is not picked up consistently on a regular basis? That infant is going to be a mistrust infant. You're probably going to see that child quiet, shut down, and not even give you eye contact. They don't want to be hurt, so they don't pay attention. And it's a real obvious thing. It's like a flat affect. They just don't want to be giggling like the happy baby who's trustworthy. Now cognitive, Piaget, thinking. Well, what did I just tell you the first thing they learned? Well, the first thing they did is you smacked them on their butt and they took a breath, right? That's what they learned first. Then what do? We put a breast in their mouth or a bottle in their mouth and they suck and swallow. Oh, and they breathe too. So now they've learned 3 things since they've come out. Then all of a sudden, that baby, as I said, reflex grabbed a rattle, and all of a sudden they moved it, and it made a sound. And oh, I like that. Well, the next time they get the rattle, they're going to voluntarily grab it and shake it because they like the noise. Well, then all of a sudden, let's continue this learning. That rattle went in the mouth and now they're sucking on that rattle. And they explore the world in their mouth, they soothe themselves in their mouth. They're happy when they're, satisfying that need, okay? So do you see it's a schema how you learn something small and you make it more and more and more and more. That's what Piaget talks about. So we're talking just the little things right now. Now, as we get older and we get into the pre-operational part of Piaget, he starts talking about the magical thinking of a toddler. He's starting to think that they put their arms out like they're an airplane. They get a broom and ride the broom around. Or they say, oh, the tree has leaves so that when it rains, it won't get wet. There's, animism within, just, stairs, you fell on it. Oh, bad stairs, you made me trip. I mean, all of these things, starting to think. Now, I'm not going to go into concrete or formal yet. That's next week. And I don't want to confuse you with it. Just know that the beginning is learning how to doing things to the point, just satisfying needs, and even with the oral. And then it's, being magical in the thinking and creative and making your own little play environment with your arms out in the plane and the trees and etc. They're starting to learn all about their body image and looking at things and knowing that they have noses or things that stick out. They're still not completely, into it yet, but they know it's there. Another thing that happens in the first year of life is you could put a toy out in front of them. Let's say they're on tummy time. And then you put it and hide it behind something. That infant still knows that that is still there. And what they call that important concept is called object permanence. Just because it's out of sight does not mean it's out of mind. They're still going to go looking for it. Object permanence. Separation anxiety. This is what happens when a child is, let's say, admitted to the hospital. And then let's say mommy can't stay because she has another child or she has to go to work or whatever. Life is showing up and they have to leave the child in the hospital alone. And it happens. And what does the child do when mommy walks out the door? Gonna scream and yell and go crazy, right? It's what they do. Mommy, mommy, mommy. And they're gonna cry and cry and cry. Yes, nursing staff will do whatever. That's of course understood. But all of a sudden they realize, all right, mommy's gone. And they go into more of a grief, as in they go and they regress. They'll start sucking their thumb for comfort. Remember, oral, taking care, comfort, sucking thumb, giving them comfort. Sometimes they are potty trained and they're incontinent. It's part of that regression. And then the third stage is that mommy and daddy come back and the child does not want to go to the mommy or daddy. And you're saying, but wait, they were crying and screaming. What happened? Well, if the baby cried and screamed, the mommy didn't come back, she's angry and upset and mad that you left me here. So if I go back to you and hug you, you're going to leave me again, and I have to go through that same feeling again. So I'd rather not. That's what they say with separation anxiety. Now, stranger fear. We know young children don't want to come out of mommy's arms. But we know as they get a little older, they get more curious, and they start peeking at you like, ooh, who is this person who wants to come get me? We know as they get older, they're going to be speaking more, talking more. We start out with crying and cooing, and it gets more and blah, 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 blah as we get going. It's just part of that development. And of course, what does any infant child do from the moment they wake up? They play. They play. They play. So toddlers, the dive bomb kids, as I call them. I love this Jerry Seinfeld phrase. Having a 2-year-old is like having a blender without a lid. Oh, and turn it on. They're everywhere, every place at one time.
That's
They
true.
are so active and you've got to watch them. Yes, it is true. Being a mother and raising children, and then I did have my grandson here up till he was 3. So I watched this toddler and the terrible twos and into everything. And it is, you can't really take your eye off. But isn't this all about being themselves and wanting to do it themselves? This is all about me, mine. This is all about what is this and what is that? And how does that work? And where can I put this? And oh, what's this? And what's that shiny thing? And let's put them together. Oh, let's put it in the mouth and let's pull on this. And they're all over. Intense environmental exploration. As toddlers, what happens when you're infants? Infants tend to eat a lot. Why? Because they're gaining a lot of weight. They're getting big quick. They have tripled their weight in 1 year. That'll never happen again unless you really gain a lot of weight for a different reason, right? You never will do that again in a normal fashion. But now infants are slowing down as they get to be toddlers. They're not gaining as tall. Look, the birth weight should quadruple now. It tripled at 1 year, right? It doesn't quadruple till 2.5 years. So, do they need all of that nutrition? What is said is they need 1 tablespoon of food per year of age for every time they sit down. And that's the key. So that is, infants. And then they become picky. As I said, head circumference is equal to chest, or again, it should be the chest bigger than the head as they get over 1 year old. All their body systems are getting more mature. You think of toddlers, we think of, yes, they're into everything, but this is the age if we start potty training. The one mistake that we think is we think that they get their urine controlled before their bowel. No, they can feel their stool coming before they can feel their bowel in there, okay? So they're starting to figure out I can hold my urine. They're starting to potty train. They're starting to get more independent. They're starting to do things themselves, and they're pretty good about this. Body temperature is fine. You don't have to put extra clothes on them and that. And remember, this is the age, especially if you have to have them in daycare of any sort or in some sort of home environment with other children. The thing with children, when they get together and play, they swap spit all day long. So one child who's sick is going to equal all children sick eventually. And even in the bestest of daycare, they can go around with swabs and spray all the time. It's still, kids tend to take a toy from that child to me to in my mouth because that's what children do. Because of that, upper respiratory, ear infections, tonsillitis are common. There's very short, narrow, wide open eustachian tubes, and that mucus goes up into those ears. And just having smoke in the house and that irritation can do this. Their fine and gross motor skills are getting more and more coordinated. They can use both hands by 12 to 15 months, and they can throw a ball by 18 months. Their eyesight's getting a lot better. Their depth perception's good now. Whereas they had both eyes working separately at birth, about 9 months, they start to work together to get that depth perception. Well, by the time they're toddlers, your visual acuity is much better and that depth perception's a lot better. Now, as I said, they become picky eaters. They don't need to eat as much. One thing about children, unlike adults, children who are not hungry are not going to eat. No matter how much you want them to, they're not going to. An adult who sees something that looks good is going to eat it anyway because it looks good. A child's not going to do that, which is quite impressive. So a child who is a toddler who doesn't need that much food is not going to eat that much. And when they eat, they're going to become even more finicky because they start that smell, that taste, that touch. They're going to be very aware of it. Have you ever tasted baby formula, baby cereal, or baby food? It is not nice, most of it. But infants, they don't have that big taste test. They don't understand it as well as the toddlers. Toddlers are really starting to understand. So now they're getting, oh, I only want macaroni and cheese, and I want my chicken nuggets or my broccoli, or I mean, there are certain things, and apple juice, of course. And these are things that they want to eat, and they don't really want to try anything else there. Now, is this okay? As long as they're gaining weight and cognitively they're where they should be, they're gaining enough food, they're doing okay with their nutrition. Again, it's really difficult. Now, as I said, toddlers, when we talk about Erickson and how we relate to other people, toddlers don't want to relate to other people. Autonomy. I want to do it me, mine, all by myself. Automatically me, mine. I want to do this. I want to get dressed. I want to feed myself. I want to go over there. I want to, I want to, I want to. And they will. But there's somebody telling them, don't do that. Be careful. You're going to get hurt. Here, let me help you. Let me do that for you. And you don't give that toddler a chance to try. They get shame and doubt. Like, well, why are they doing that? I could do that. So that gives them, like, I don't understand. Even though they're little toddlers, this is what Erickson, this theorist, felt about it. Okay. So we went over most of about Piaget. We started about learning how, things work. We start on little things, as we know that they learn how to breathe and they suck and swallow. Then they learn that things in their mouth is comfortable and feels good, noises sound good. We build upon that as we go along. Now, there's one thing I wanted to show you. Thing about thinking. And as we get to be a toddler, that's that tertiary circular reactions. Toddlers now are getting pretty smart. As infants, we would see, all right, that rattle rattles, I'll get it again and I'll do it. Oh, it tastes good in my mouth, I'll do it again. Well, now you're getting to the point where I know now how to manipulate my mommy. I knocked off my sippy cup. Mommy ran over to get it, rinsed it off, and gave it back to me and says, here you are, sweetie. You're like, oh, I know how to get my mommy back to me when she don't want to be here or she's not next to me. And they throw the sippy cup on the floor again. That is tertiary circular reactions. They figured it out through happenstance, and now they're going to use it to their benefit. Toddlers are starting to know that there's mommy and daddy got different tools down there. Remember, they are potty training. So they're seeing daddy standing, mommy sitting. They're trying to figure this out. They do touch themselves down there. They're starting this playing house. And they're knowing that there's differences between boys and girls. We know that children, if they have to go out and away from the house with other people, whether in a hospital or something, the point of this slide is talking about transitional objects. There is something that a kid likes. It's a certain sippy cup or a certain bottle or pacifier or blanket or a little toy, whatever it is. There is something that gives comfort to a child. Again, encouraging parents to have that if they needed to be separated for any reasons. Now, toddlers, they are understanding more. Remember, there's one word spoken by 1-year-old. Could be Nana, Pop Pop, mommy, daddy, or whatever it's going to be. And then they start learning more and more and more words. Now, the thing about toddlers, they know more than that they can express verbally. So they're trying to talk to you, tell you things about stuff, and they don't know the words. And they're getting frustrated because you're not understanding, and you're getting frustrated because they're not understanding. So the thing about toddlers is to say, okay, show me another word. Or here, show me what you're trying to tell me to stop that, especially in a hospital experience. And if they're frustrated, they're anxious, figure out what it is, and it actually saves so much in the long run that you address that then. Play. What type of play is specific to toddlers? I have my toys. You have your toys. We're next to each other, but we're not sharing. Parallel play. Toddlers, parallel play. They could imitate, they can have stuff with tactile stuff or with others, but play, toddlers, parallel. They don't share. Mine. As I said, potty training, they start it, bow before bladder. They start getting a dry diaper for 2 hours, and that's basically the time to start. There is always some sort of sibling rivalry, depending on who's first, who's second. All of those things individually have to be addressed. Temper tantrum, I think that used to always happen in the grocery store to me, going down the cereal aisle, right? They wanted to get a certain cereal that had a certain toy, and it was double the price of the other cereal. You know how it is, and they all want a different one. You're like, no, and they fall on the ground and have a moment. Well, as long as they're not hurting themselves or others, they say with temper tantrums to walk away from it. If you acknowledge it, that's what they want. They want you to pay attention. They want you to say, oh, I'm having a temper tantrum. They want you to see them having that and get them what they want, right? As I said, Mimi, my mind, no, 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 is absolutely them. And in stress, toddlers do go back and regress, as in sucking thumb, maybe incontinent when they are stressed. It's one way to tell with a toddler. Remember nutrition, they are physiologic, anorexic, they don't eat that much. Making sure that the little food that they get is appropriate. Know that there are cultures with different dietary restrictions. It could be strictly vegetarian. Are they getting the protein they need? Or they're not on whole milk. Are they getting the calcium and vitamin D that they need? Or are they getting the lean red meat for protein? Again, maybe they don't eat meat. Again, understanding that special diets and nutrition, you need to remember about these other little things that could cause problems. Lactose intolerant, are they getting enough calcium, etc. These things are important to remember. Supplementary type of medicine, these again must be discussed and divulged, so the physician knows, because it can interfere with care. We've already talked about sleep. We've already talked about dental health, knowing we start as soon as they start getting teeth at 6 months, they should be getting regular dental examinations. And then after 6 years old, they should be flossing. Knowing that at 1 year old, they're still not quite have enough of that control to do it. But mothers should help at 6 and as they get older to assist them with flossing morning and night. Always be concerned about environmental hazards. Mercury poisoning used to be the thermometers with the mercury in them. Lead poisoning, we still have some of that with old buildings, and the paint has lead in them. Know that you'll start seeing different treatment with it. There's something called chelation therapy. You've heard this when you get too much iron in your body, and it looks like dialysis machine. And it's that machine sitting right there. But they only pull out the lead. They don't pull out toxins or any of that stuff. And that's apheresis, and that's part of chelation therapy. All it does is pull out the lead. Or they can give oral chelation medication, which combines the lead and urinates it out. The one thing about talking about ingestion and poison control, know that the first thing that should be done is to call 911 to get a hold of that poison control person, find out what needs to be done. We do not encourage ipecac and vomiting. Not many years ago we did, no more. So making sure poison control, it could say, give them a glass of milk as you're transporting to the nearest ER for treatment. Okay. So getting that treatment initially as quick as we can as possible. Again, safety, number one, any level child, motor vehicle. Again, toddlers, all about the car seats. Know that at age 2 or 30 pounds, it could be a rear seat, front facing. And then, of course, safety promotion, again, teaching parents about being safe in their house, those burns, the falls, the aspirations, the swim pool, etc. Car seats, I remember that little metal box up there. And I remember my brother sitting in the front seat of this big black car we had back probably the late 50s, if I'm not mistaken, a long time ago. And it's amazing to know how so much research has been done to keep our children safe, and even the car seats. Remember, we shouldn't use any old ones, nothing older than 10 years old. Little lightly used, it was your friends that that it's never been in an accident, etc. They can be used, and of course, new ones can be used. So preschoolers, ages 3 to 5. Now we're getting smarter. These children are getting more independent. These children are thirsty, 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 thirsty for knowledge at all times. And it's fun to watch them to grow. Goal for these children is to get them ready to go into school, reading to them, giving that positive attitude parents should be all the time. And then, doing things that will increase their attention span. They say it's like 15 minutes is all they get for each activity when they first get to preschool, because kids are up and they're moving a lot. So we can teach that and them with some sort of programs after school, before they get to preschool. Growth is about the same as toddler, very slow. They get a little pudgy and they get taller. And they get a little pudgy and then they get taller. Same thing. Gross motor, G, get up, go, go, go. So ages 3 to 5. Walking, running, climbing, jumping. They're doing all of it. Fine motor, we're doing circles. We're cutting with scissors. We're buttoning our buttons on our shirts. We're drawing in the lines and we're getting ourselves dressed. All of these things we're doing now. Now, Erickson's is about the way they treat other people and acknowledgement of that. So it's that social type of environment here, psychosocial. Now, preschoolers like to try to help and do things, but sometimes when they try to help to do things, not everything works out the way that they want, and they might get yelled at, right? So it is that sense of initiative that they do. They want to get up and they do it. But again, they have that feel of guilt for, gee, I should have known that, or, that shouldn't have happened like that. But the thing, and it's also part of Kohlberg, is again, understanding people is knowing the right and wrong way now to treat people. We did that. We did, okay. Piaget and preschoolers. So again, thinking. Piaget, thinking. How do I think now? Well, my language is getting more. I'm expressing myself better. They still don't understand time. Time is after lunch, daddy's coming to get you. They don't know a clock yet, but they know an event attached to a time, and they can relate to that. And now they are magically thinking. They're creating, they're own little environment, their own little play by themselves talking. You'll have trucks flying and cars and all different things and dolls and beds, and it's just part of the way that they're thinking now. Goldberg is all about morality. They say with preschoolers, what they understand is reward and punishment, as in there's a right and wrong and a consequence for each. Preschoolers, reward and punishment. Their body image, basically, they don't like to fall down and get blood. And they think when it's blooding, that, especially if there's a lot of blood, that their insides is going to come out and they're just going to die. This is the age of put a Band-Aid on and it cures everything. I probably have 1,000 Band-Aids in this house, from Batman to SpongeBob to Spider-Man to whoever. Because if there's a little blood, they fell down, you put a Band-Aid on it, everything's all better. They think, and they don't understand it, their insides are coming. Another thing about getting hurt and being a preschooler, they truly believe that something bad happened to them. And let's say they fell down and broke their arm. They fell down and broke their arm because yesterday they hit their sister. They shouldn't have done that. So they did something bad. That's their true belief. They believe God punished them. Again, their faith and religion is what they know. If they know Santa Claus or do they know Jesus is what the family talks about. And again, they said misinterpret illness as punishment from a higher power. That's what I was just talking about. They know there's boys and there's girls. We know boys like their mommies. We know like girls like their daddies. And we know that they're starting to understand their roles. They're starting to get inquisitive about, making babies. Their separation, they don't mind it as much, like stranger danger or fear. They're not as fearful anymore because moms come back and they realize it. Play therapy is one of those things that we do use, or it's also called dramatic therapy or play therapy, is used. Let's say a child's had a really bad experience in a hospital or somewhere, and we're trying to figure out what happened so that we can take care of their child because they seem so distressed. Well, through play therapy with a good therapist, we can have that child with toys and dolls and things play through it, and it's not harmful to them, and they get to express what upset them. Preschoolers are getting more verbal, understanding moral. I think this is the age where they make up words. Christian loved the word transportation, teleportation. He just think those are great words, and he's going to be teleported somewhere. But again, he grew out of it. He's 8 years old now, just turned on last Thursday. But it's funny that there's these strange words that they try to fit in, and they're big, multi-syllable words that they're trying to use. But it's trying to understand, what is he trying to tell you? Preschoolers don't need as much of rules, the rights, the wrongs, the rules. These children don't have to have the same food. They don't have the same bedtime, bath time. They don't need it like toddlers. Now, I've always said taking a toddler on vacation or in a hospital is the hardest group because they don't understand, and they're very scared. The best way to treat them, of course, is through all being a ritual, doing that routine you do. Now, preschoolers tend to tolerate it so much better as long as you tell them what's going on. They do start having their own voice. The times they challenge it. For instance, well, it's time to go to bed. Well, my cousin Joey didn't have to go to bed yet. Well, cousin Joey's 10 and you're 8, okay? So he gets another couple minutes. So again, those challenging starts. And as I said, a lot is at bedtime. All your sorts of play. What do you need to know? Parallel play, toddlers. Associative play, preschoolers. What's associative play? Two or more children playing together, touching and playing with the same toys, playing with all of them together, but there's no rule, there's no goal, there's nobody wins. You don't make a house, you don't make a racetrack, you make nothing. You play together. That's associative. Toddlers, parallel. Don't touch my toys, but you can play next to me. Okay? Preschoolers are afraid of the dark, being afraid of left alone, afraid of ghosts. They're also afraid of big dogs that are going to hurt them. They're also actually afraid of having their body parts, like their penis or something, cut off. That castration. They're also objects or people associated with pain. Now they're preschoolers. Their ages 3 to 5, almost 6. Who's that object associated, a person associated with pain? It's us nurses. What have we done? How many immunizations have we done? Blood pressures, blood draws, all of these things. So again, it's building the rapport with that child, which will make it they're not as afraid as those people who inflict pain, right? Sex education, they're starting to be curious. They're starting to touch themselves, masturbate. What are things that we need to teach these children? Because they don't have any filter. They could be touching themselves in public in front of other people. Again, it's like, okay, take your hands out of your pants, or, go to your room or go in the bathroom. That's private. You don't do that in front of people. Whatever you want to tell them, that's the way you should do it. Another thing, and it is a parental, if they want to or not, is using correct anatomic words. Christian knows a penis and a vagina. That's all he's ever known. So that we do use those words. They're not like a bad word to him at this point. Speech problems start to occur somewhere between 2 to 4 months. Again, number one, problem with speech, what are you going to check first? It's hearing. If you can hear okay, you should be able to speak okay. But if you can't hear, it should be a garbled speech. And that could be that clue there, okay? And this is getting that early intervention and getting them into speech therapy. Sometimes they can sleep through the night, sometimes they don't. As I said, sometimes they can have night terrors. Children at night. My second grandson had really bad night terrors, and they actually had to put him on melatonin at night to keep him asleep. He would be asleep and he would be screaming in his sleep, and he'd be asleep during it. So he did eventually, of course, grow out of it, but it's part of what kids go through. Injury preschoolers, what do you think is number one? Vehicle. And why are injuries getting more and more in preschoolers? Well, they're more mobile. They're on, bikes and skates and skateboards, and they're out on the streets and the sidewalks, and they're being hit by cars and all of these things. Again, making sure proper safety equipment is key, and that we do teach our parents about that. So, communicable diseases. Well, we know that many, many, many diseases have gone away. I mean, when I was young, there was polio and smallpox and all of these things. And, thank goodness to all the immunizations that we have available today that, these things have basically been wiped out. And if we start to see incidences of it, it's those people who, due to whatever choice, do not want to be immunized. And it does give the chance of that disease being around us. The one thing about communicable diseases is always us hand washing. It's always, if we are suspecting any communicable disease, We suspect things like chicken pox, you know, making sure that we know that it's spread in airborne, putting the mask on the child, getting them in airflow rooms. These are things that we need to think about with communicable diseases, you know, and again, always following infection control policies of your hospital. Pink eye, conjunctivitis, big thing in kids, you know, that does occur. Know that with conjunctivitis is to keep those eyes clean, get those green goobers out of there, put the ointment on. Know that ointment will make the eye go cloudy. Warn the child. It's going to go cloudy, then it's going to melt, and then you're going to be able to see. And the other thing, by helping to prevent infection, is I always tell the parents to change the pillowcases every single day, because it's all of that bacteria, that staph is in the pillowcase. So that's what I would do. Same thing with stomatitis or those cold sores on the lips. They do hurt. And a lot of it's pain relief so that they can get nutrition. We can have pinworms. We can have roundworms. Children go outside. They play in the dirt. Fingernails need to be short. Eggs get underneath them. They put their hands in their mouth. It's what they do. And they do get worms. The way that we determine if there is, for instance, the enterobiasis, these little pinworms, they're tiny, itsy bitsy little things. We would have intense perianal itching at night. So we'll go in with a scotch tape and tape the anus, and we'll be able to see a little worm, and then the doctor can make the diagnosis. Know that if a child has pinworms, they're going to treat the whole family, because possibility everybody does. Now, as maybe potential pediatric nurses, some of you, maybe some of you want to do it. One of the things that you need to understand is we are held responsible for the safety of the children in our care. If we suspect neglect, it is our duty to let somebody know and to get it investigated. It's better to be safe than to be sorry. Now, you want to ask me, have I ever seen child abuse? And yes, I've seen some horrible child abuse. The last one I saw was a 3-month-old infant who was picked up by the feet and hit on the head in a shower. And his head was smushed. He had a fractured humerus, and he had a fractured femur, and he had some fractured ribs. And they were at multiple stages of healing. And the kid came in because the head was tender, and the mother noticed some discoloration. Well, it wasn't the mother. Anyway, we did save that child. We got them out of that terrible environment, and he is safe today. Another child I saw was about like 6 or 7. The father had locked this child in a room, strapped him to a bed, and hadn't fed him anything, not even water. The child came in, he had not a stitch of fat on him. His face, his eyes were sunken. You could see his cheeks. He had areas of decubitus from laying on his one side. And I still, to this day, can smell that child. The child came into the ER. The father brought him in. And as he got there, the child coded. I was in another area, and it was an early Saturday morning. And they called me immediately over into the trauma room. And we did save that child. He came down 3 weeks later to say hello to all of us. And again, that child is in another environment, and he is safe today. Again, child abuse, child neglect is real, and it's something we don't like to think about. But I know that these children, because I mentioned it, listen, something's not right here. I had it looked at, and my suspicions were correct, and I wish they weren't. Another way of child abuse that can occur is something called Munchausen syndrome by proxy. Has anybody ever heard of Munchausen syndrome? It's when you have a close person to the child, usually the mother or father, who keep a kid sick. They like seeing their kid sick. They like their kid in hospitals and medical care getting medical treatments. They do things like having wounds and putting dirt and germs in them, or taking toilet water and putting it in IVs, or giving them medications that are going to harm them, all sorts of horrible different little things. Okay. Now, this child now is in a hospital. You are suspecting, and the hospital is suspecting Munchausen syndrome. How do you treat that child? How do you keep that child safe? Well, you don't have to have anybody in there 24 hours a day. Okay. What you need is to have a somebody in that room when that mother or whoever suspected goes in that room, and to make sure whatever they bring into that child is all examined. Some other things we do with this is we make sure that we keep the same nursing staff on that child who understand the dynamics there, to give that child some sort of security. Okay. But Munchausen syndrome, it is real. It does happen. And unfortunately, sometimes these children get really, really sick, and they get to the point where they're sick and you can't bring them back to being, quote, normal again. Yeah, Tamika,
Didn't Gypsy Rose, wasn't that what her mom did to her? Gypsy?
I believe so. Yes, it sounds familiar to me. Yes, there's so many. I mean, you see them with, your beauty queen kids, and you know they tend to do all of these things. Yes, yes, absolutely. All right. So, thing about child maltreatment, know that the big thing is the injuries and the story on how they got it. Do they match? And if they don't make sense, it's something to be investigated. So the parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? So remember, 3-year-olds, preschoolers, they're starting to know body parts. They are into touching themselves. They're questioning all of these things. What would you do if that happened to you?
Is it B?
Yes, it is. It is B. Don't condone or condemn. Say, all right, come on, let's go. Let's wash our hands. Let's go get, a popsicle. Change the subject, get them out of there. Touching themselves and exploration is not bad, as long as it's controlled, right? At this age, it's innocent. Of course, older, something else. But again, you don't want them to feel bad about themselves, okay? Don't make them feel icky. So tonight, we really don't have time to do a Kahoot. We're right here. It's 10 o'clock. It's a 60-question Kahoot. Now, I do have from last night, because it is a longer class, I do have their recording with the Kahoot, and I can send that to you with all of, the information that goes along with you. Is that okay for all of you to have? You guys all look exhausted. I've never seen the heads all go at once. Yes, I've had enough. Please let us go. We're very tired. So remember, next week we have a quiz that'll be on this week's information. All of the stuff that you've heard, today, you're going to see there's going to be nothing different than that. Remember, please send me what you want to do for your pediatric assessment project. Start thinking about it. I mean, some of you have children with ADHD, autism, Downs. that's what you want to do, because that is somebody that you're close with, let me know before somebody gets that diagnosis, and that I don't want 4 or 5 of the same thing, okay? So anyway, guys, been a great evening. Remember next week to start look for those reviews, and I'll see you next week for quiz 2. Good job tonight. Take
Good
care.
night. Thank you.